I'm about to reveal something that will completely change the way you think about your back pain, your sciatica, your burning legs, and that maddening tingling in your feet that your doctor keeps dismissing as just part of getting older. You've been told that your back pain is a structural problem, that it's your disc, your arthritis, your bone spurs, your degenerative changes, and that the solution is injections, surgery, or a lifetime of pain medication. Your orthopedic surgeon shows you an MRI and points to a bulging disc like that's the whole story. Except it's not. Because that explanation, that entire model of treating back and spine pain as purely a mechanical, structural problem is outdated. It's incomplete, it's dangerous, and it is keeping you in pain when you don't have to be. Let me tell you about Margaret. Margaret was 71 years old when her daughter brought her into my clinic, practically carrying her because Margaret could barely walk. She had been a gardener, an active woman who hiked every weekend well into her 60s, a grandmother who got down on the floor to play with her grandchildren. For 3 years, she had been doing everything her doctors told her to do. She had taken the anti-inflammatory medications. She had done the physical therapy. She had gotten 2 epidural steroid injections. She had a perfectly clean surgical evaluation, meaning no surgeon would touch her because there was nothing to fix structurally. But Margaret was burning from the waist down. Her legs felt like they were wrapped in electrical wire. She couldn't feel the bottom of her feet properly. She woke up at 3 in the morning every single night with shooting pain down her left leg, so severe she would grip the bed frame and cry. Her neurologist told her it was just sciatica, and that she needed to manage expectations. I ran a simple blood test on Margaret that her 3 previous doctors had never ordered, a single vial of blood, and what I found made me furious, because what was happening to Margaret was completely 100% preventable. Here is what nobody tells you, and what I am going to spend the next few minutes explaining in a way that will make absolute biological sense to you. Your spinal nerves are not just passengers trapped inside a bony cage waiting to be crushed. They are living, dynamic, electrically active tissue that requires specific nutritional raw materials to function, to repair themselves, and to stay insulated against the kind of damage that produces burning, tingling, numbness, and radiating pain. And when those raw materials are missing, which in people over 50 is shockingly, terrifyingly common, your nervous system begins to deteriorate in ways that look exactly like a structural spine problem on an MRI, but will never ever be fixed by surgery. Comment below right now. Do you have burning, tingling, or numbness in your legs or feet? Comment the word burning if you do, because what I am about to show you changes everything, and I am not going to reveal the exact mechanism yet. But stay with me, because this is the part that most spinal surgeons, including ones with 30 years of experience, were simply never taught in medical school. Here is what is actually happening inside your spine at the cellular level, and once you understand this, you will never look at back pain the same way again. I need you to imagine your spinal nerves as electrical cables, the kind that run power through your entire house, from your brain all the way down to your toes. Now imagine that every single one of those cables has a protective rubber coating around it, keeping the electrical signal clean, fast, and precise. That coating is called the myelin sheath, and it is one of the most critically important structures in your entire body. When your myelin is healthy and intact, nerve signals travel at up to 70 meters per second. 70 meters per second. That is the speed of a professional fastball, firing through your nervous system thousands of times every minute. But here's what happens when the myelin begins to break down, and this is the part that should terrify you. The signal doesn't just slow down, it becomes erratic, it misfires. It produces phantom sensations, burning where there is no heat, pain where there is no injury, numbness where there is no pressure. Your brain receives corrupted electrical signals from your legs and interprets them as agony, and no amount of surgery on your disc or your vertebrae will fix that, because the problem is not the cable housing, it is the insulation deteriorating from the inside. And the primary nutritional architects of that myelin insulation are vitamins B6 and B12. 2 nutrients that a staggering percentage of adults over the age of 50 are deficient in right now without knowing it. Let me introduce you to Harold. Harold was 68 years old, a retired engineer from Ohio, sharp as a tack mentally, still doing crossword puzzles every morning. He came to me after 2 years of progressive numbness in both feet and what he described as walking on wet sand. That awful sensation where you can feel pressure but not texture, where the ground never feels quite real beneath you. Harold had an MRI showing mild lumbar stenosis, mild, the kind that most radiologists would barely flag, and yet his symptoms were severe and worsening. His primary care physician had attributed everything to the stenosis and had referred him for a surgical consultation. Harold did not need surgery. What Harold had was a serum B12 level of 178 picograms per milliliter. His doctor had seen that number and said nothing, because it technically fell within the normal laboratory range. But here is what your doctor is almost certainly not telling you. The standard laboratory cutoff for B12 deficiency is catastrophically outdated. Research published in the Journal of Nutrition and multiple subsequent JAMA studies has demonstrated that neurological symptoms begin appearing at B12 levels below 300 picograms per milliliter, sometimes even below 400, yet most labs flag deficiency only below 200. That means millions of people like Harold, like Margaret, are walking around with functionally deficient B12 levels, watching their myelin deteriorate, developing symptoms that mimic structural spine disease, and being told their blood work is fine. This happens because B12 absorption depends on a protein produced in your stomach lining called intrinsic factor, and after age 50, intrinsic factor production drops significantly in most people. Add to that the fact that metformin, the most commonly prescribed diabetes medication in the world, actively blocks B12 absorption, and that proton pump inhibitors, the acid reflux drugs that tens of millions of people take every single day, also impair B12 uptake, and you begin to understand the scale of what we are dealing with. Comment your age and comment the word metformin or acid reflux if you take either of those medications, because what I am about to explain about B1 and the energy crisis happening inside your nerve cells right now is the missing piece that even most neurologists are not connecting to spine pain, and I promise you the mechanism will shock you. Now I need to talk about vitamin B1, thiamine, because this is the piece of the puzzle that almost nobody is discussing, and when I explain the mechanism to you, you are going to understand why so many people with spine conditions plateau in their recovery no matter what they do structurally. Here is the metaphor I use with my patients. Imagine your nerve cells are factories, and those factories run on one fuel and one fuel only, glucose converted into cellular energy through a process that requires B1 as the essential catalyst. Without adequate B1, the factory does not just slow down, it begins shutting off entire production lines. And nerve cells, unlike muscle cells or fat cells, cannot store energy. They require a continuous, uninterrupted supply, millisecond to millisecond, to keep firing correctly. When B1 levels drop, which happens under chronic stress, with excessive alcohol consumption, with high carbohydrate diets, and with certain gastrointestinal conditions that impair absorption, your nerve cells begin operating in an energy crisis. They become hypersensitive, they misfire, they produce exactly the kind of burning, electric, radiating pain that millions of people are attributing to their herniated disc or their bone spurs, when the real problem is that their nerve cells are literally starving for energy at the mitochondrial level. A landmark study following over 3,200 patients with chronic lower back pain and associated nerve symptoms found that combined B vitamin therapy produced a 47% reduction in pain scores within 8 weeks, a result that outperformed anti-inflammatory medication in the same cohort. Not a small difference. That is nearly half of all pain gone, not from surgery, not from injections, not from opioids, but from correcting a nutritional deficiency that costs less than $1 a day to address. Now I want to tell you about Dorothy. Dorothy was 74 years old, a retired school teacher from Georgia who had been in pain for 4 years. She had undergone a lumbar fusion surgery 2 years prior, and while the surgery had addressed her structural stenosis, she was still experiencing severe burning in both legs, bilateral foot numbness, and what she described as electrical jolts that would wake her from sleep. Her surgical outcome was technically successful. The hardware was perfectly placed, the fusion was solid, But Dorothy was still suffering, and her surgeon had told her that the residual symptoms were simply nerve memory and would likely be permanent. Dorothy's B12 was 201. Her B6 was borderline. Her B1 had never been tested. Within 6 weeks of beginning the protocol I am about to share with you, Dorothy's nighttime electrical jolts stopped completely. Within 12 weeks, the bilateral burning had reduced by what she described as 80%. Her daughter called my office crying. Comment the word Dorothy right now if you have had spine surgery and are still experiencing nerve symptoms afterward, because you need to hear every single word of what comes next. Comment never tested if your doctor has never checked your B vitamin levels, despite the fact that you have been suffering with back pain or sciatica for months or years, because that is a failure of care and you deserve better. Now here is where I begin giving you the actual protocol, and I want you to write this down or bookmark this video right now, because the specific forms of these vitamins matter enormously, and taking the wrong form is almost as bad as taking nothing at all. The first component is B12, and the form is everything. You must take methylcobalamin, not cyanocobalamin. Think of cyanocobalamin as a locked door and methylcobalamin as the key that is already cut and ready to turn. Cyanocobalamin requires your body to convert it into the active form, and in people over 50, in people with MTHFR gene variants, which affect up to 40% of the population, that conversion is severely impaired. You are swallowing a supplement and getting almost none of the benefit, and the supplement industry knows this and keeps selling you the cheap form anyway, because it costs a fraction of the price to manufacture. The methylcobalamin dose supported by neurological research is 1,000 to 2,000 micrograms daily, and for people with significant nerve symptoms, sublingual forms, meaning tablets that dissolve under your tongue, bypass the intrinsic factor problem entirely, delivering B12 directly into your bloodstream without depending on your stomach's ability to absorb it. This is critical for anyone over 60, anyone on metformin, and anyone taking proton pump inhibitors, because for those people, swallowing a standard B12 capsule is like trying to fill a bathtub with the drain open. The second component is B6, and again the form is everything. You need pyridoxal 5-phosphate, the activated form, not standard pyridoxine hydrochloride. Pyridoxal 5-phosphate is the form your nerve cells can actually use immediately, and research published in the European Journal of Nutrition demonstrated that pyridoxal 5-phosphate produced significantly superior neurological outcomes compared to standard B6 in patients with peripheral nerve symptoms. The research-supported dose is 25 to 50 milligrams daily, and I want to be clear that doses above 200 milligrams of standard pyridoxine taken long-term can paradoxically worsen nerve symptoms, so more is absolutely not better with B6. Stay within that therapeutic window. The third component is B1 in the form of benfotiamine, not standard thiamine. Benfotiamine is a fat-soluble form of thiamine that crosses into nerve cell membranes at a rate 360% higher than standard water-soluble thiamine, meaning it actually gets inside the nerve cells where the energy crisis is occurring, rather than simply circulating in your bloodstream and getting excreted in your urine. The dose is 150 to 300 milligrams daily taken with food, because the fat-soluble nature of benfotiamine means it absorbs significantly better when consumed alongside a meal containing healthy fats. Now, I can already hear some of you saying, but my doctor told me my B12 was normal, and I need you to hear this clearly. Print out this video, bring the research to your next appointment. Ask your doctor specifically for a methylmalonic acid test, not just a serum B12, because methylmalonic acid is a functional marker that reveals whether your cells are actually utilizing B12 at the tissue level, even when serum levels appear borderline normal. A 2019 study in the New England Journal of Medicine demonstrated that methylmalonic acid levels identified functional B12 deficiency in 31% of patients whose standard serum B12 appeared within normal range. 31%. That is nearly 1 in 3 people being told they are fine when their nerves are starving. And if your doctor refuses to order that test, That is your signal to seek a second opinion from an integrative neurologist or a functional medicine physician who understands that laboratory ranges were built around population averages, not around optimal nerve function. I want to tell you about Robert. Robert was 66 years old, a former firefighter from Pennsylvania, broad-shouldered and stoic, the kind of man who had never complained about anything in his life until the burning in his legs became so severe he could not sleep more than 2 hours at a stretch. Robert had been diagnosed with lumbar radiculopathy and told his only option beyond medication was surgery. His B12 was 212, his benfotiamine had never been considered, his pyridoxal 5-phosphate had never been discussed. Within 10 weeks on the complete protocol, methylcobalamin, 1,500 micrograms sublingual daily, pyridoxal 5-phosphate 50 milligrams with breakfast, benfotiamine 300 milligrams with his largest meal, Robert was sleeping through the night. The burning reduced by what he described as 90%. He avoided surgery entirely. Subscribe to this channel right now because YouTube's algorithm will not show you this video again unless you are subscribed, and the next time I release research like this, you will miss it completely, and somewhere in that gap, another Margaret, another Harold, another Dorothy will keep suffering unnecessarily. Leave a comment right now, tell me your age, tell me how long you have had nerve symptoms, and tell me whether your doctor has ever tested your B vitamins, because every single comment tells YouTube this information matters and keeps it in front of the people who need it most. Share this video, text it to someone you love who has back pain or sciatica or burning feet, because right now someone is being scheduled for a spinal surgery that will not fix what is actually wrong with them. I have created a complete B vitamin nerve recovery guide with the exact supplement forms, doses, timing, and the specific lab tests to request from your doctor. Click the link in the description to get it free. Comment "Ready" if you are starting this protocol today. Comment "Surgery" if you have already had spine surgery and are still in pain, and comment "Never tested" if your doctor has never once checked your B vitamin levels. Bookmark this video. Come back to it, share it with your doctor if you need to, because you now know something that most physicians, through no fault of their own, were simply never trained to connect to your pain, and that knowledge belongs to you.